the greatest risk factor is exposure to asbestos, and in particular a subset of asbestos called amphiboles. These are asbestos, which is a mineral, magnesium silicate, that has a long, thin, needle-like structure and can penetrate the lung and go all the way to the outside of the lung, what's called the pleura. What's interesting about asbestos exposure is there is a long latency period between the actual asbestos exposure and the development of the mesothelioma, typically 30 to 40 years, which raises interesting questions about how mesothelioma actually comes about. The second risk factor in some patients would be radiation therapy to the chest. We're seeing this in patients with Hodgkin's lymphoma that have been radiated to the chest. They have an approximately 30-fold increased risk of developing mesothelioma, and that appears to be largely independent of asbestos exposure. Interestingly, some patients who were exposed to a virus called simian virus 40, or SV40, which many of us were exposed to because polio vaccine stocks were contaminated worldwide with this from 1954 to 1963, that can alter so-called tumor suppressor gene expression and lead in many patients to mesotheliomas, among other cancers.